Bone grafting and implant dentistry, building a foundation for success. Implant dentistry has transformed dentistry in offering patients a long-lasting treatment for tooth loss. Implants not only improve the appearance of smiles, however, they also enhance the general function that the mouth. But dental implants to be effective, a solid base of bone is required. This is when the bone grafting procedure comes in. Bone grafting is an usual procedure used in implant dentistry. It involves the removal of bone from one area of the body and then inserting it into the jawbone, where the implant is put in. It provides the required foundation and support for the implant to be able to properly integrate with bone. If there isn't enough bone that can help support an implant, the chance of success rate for the implant dramatically diminishes. There are a variety of reasons patients may need the grafting of bone prior to getting an implant. The most frequent causes is the loss of bone caused by periodontal diseases. The jawbone can begin to weaken, which makes it challenging for implants to properly anchor. Furthermore, tooth loss could cause losing bone because the jawbone starts to shrink without stimulation of the tooth's root. In such cases, the bone grafting procedure is required for regenerating the bone to provide a solid base for an implant. There are a variety of different kinds of bone grafting methods which can be utilized for implant dental. Most commonly, it is autogenous bone grafting that involves removing the bone of the patient's body, typically from the jaw or hip, and then transferring it into the jawbone. This kind of grafting procedure is usually preferred since it is the most successful rate and has the least risk of rejection. A different type of bone grafting procedure is called allografting. This involves the use of the bone of a donor, typically a deceased cadaver. This kind of grafting is more gentle than autogenous grafting and removes the requirement for an additional surgical site in order to remove the bone. There is, however, an increased risk of rejection when using allografting as in comparison to autogenous transplantation. The xenografting procedure is a different kind of bone grafting procedure that uses bone taken that comes from animals, usually either a pig or cow. This kind of grafting procedure is typically used in cases where there is no bone in either the donor or patient. Although xenografting is a possibility to be successful, however, it has a greater risk of infection and rejection than autogenous transplantation. Recently, the use of artificial bone grafting material has gained popularity for implant dental. They are typically composed of ceramics or synthetic polymers and created to replicate the shape of bone. Although synthetic bone grafting substances offer adequate support to implants, they might not necessarily integrate as seamlessly with bone surrounding them in the same way as autogenous grafting. Whatever the method of bone grafting procedure used, regardless of the type, the effectiveness of the procedure is largely dependent on the proper healing of the wound and integrating the graft into the surrounding bone. That's why it's important for patients to adhere to the instructions of their dentist post-operatively so that they can ensure the best result. In the end, bone grafting is a key factor in the successful use implant dentistry. If there is no solid foundation for bone, implants run the danger of failing. If you are aware of the various kinds of bone grafting methods that are available and the significance of a wound's healing process that is properly done, patients can better prepare themselves for implant procedures and improve their odds of having a positive outcome. The foundation of a successful implant begins with having a healthy jawbone. Bone transplantation is essential in achieving this objective.